Hello, my name is Trent SCS and I'm a student physical therapist. Today I will be demonstrating the strain counter-strain technique for the inguinal tender point. Today I will be assessing the tender point and treating that tender point. Dr. Jones was the original founder of strain counter-strain, and he identified that patients with tender points in this inguinal region usually come in with complaints of groin pain, medial thigh pain, and anterior medial knee pain. A tender point, according to Dr. Jones, is referred to an area of somatic dysfunction that is 4 times as tender to palpation as a normal tissue, has abnormal tissue texture, has asymmetrical tissue and structural patterns of movement, and limitations in range of motion. These are small, hypersensitive areas that may seem edematous to touch and to palpation. I will be demonstrating the tender point for this will be on the inguinal region along the inguinal ligament that goes from the ASIS down to the pubic tubercle. During palpation for this, I think it would be best regards to tell the patient what you're doing beforehand, since this is a highly sensitive area. I would approach from an anterior or superior lateral position down along that inguinal ligament until you reach the pubic tubercle. The tender point, according to Dr. Jones, is located on the lateral portion of the pubic tubercle, and you press in a medial direction. The palpation is just enough to blanch the fingertips, and if that area, as described previously, is 4 times as sensitive and has the other properties, that is your tender point. You might have multiple tender points in this area. You want to treat and address the tender point that is the hottest or most sensitive, the point that is the most proximal to the area described, and if you have multiple ones, you want to treat the tender point that's in the middle. This technique is used to affect the neurological electrical firing sequence to the intrafusal muscle fibers to the structures and muscles in that area. So now I will demonstrate this on the patient. The patient will be in a supine position, and again, appropriate draping is required for this patient. The table should be at a comfortable height for the therapist, just at the fingertips, so that when palpation is performed, you are not leaning over. In this case, I will just raise the patient's shirt up just enough so I can have access to palpate his ASIS. From there, I can also ask the patient to palpate his own pubic tubercle. This might be demonstrated by saying, I want you to move down until you feel the bony prominence right below your belly button. Alright, from there, I will palpate his ASIS and move in that direction until I'm on that structure. From there, I will press medial on that pubic tubercle and ask for patient's response. Is that tender there?
Yeah.
Okay, so I have located the tender point. I can palpate to make sure that is the most sensitive area. Now for treatment of this area, I'm going to have the patient, to state to the patient to be completely relaxed. I'm passively going to flex both knees up to 90 degrees. Then the contralateral limb is placed over the top of the side that you're treating. In this technique, the therapist's knee is positioned on top of the table as to support the limb. As stated previously, the contralateral limb is brought over the top, and to find the mobile point, or the point where the tissue has the least restriction of ease versus bind, I can fine tune by bringing the ipsilateral leg into external rotation or internal rotation by pulling it out. I will identify the mobile point, and once that is felt, I will hold this position for 90 seconds. After 90 seconds, I will passively move the patient out of this position by first bringing the limb off and gently lowering each limb as to make sure he does not relax. Again, passively straighten out the legs, and then reassess the tender point. How much in a percent, 0 to 100, how would you present that as better?
About 70.
70%. 70% is the amount that you want the structure to be relieved by in order to have a successful strain counterstrain treatment. If the patient does not report a 70% increase or decrease in symptoms, then several things can be considered. First, the patient was not positioned in the correct manner as to find the most or hottest tender point. You might have not held the position for the full 90 seconds, and you did not treat the middle tender point.